We are now more than 18 months into the pandemic. Leaders continue to face an array of challenges, with a few signs of relief on the horizon. Hospitals continue to stand at the front line against the COVID-19 pandemic and are facing huge pressures. For this, the financial sustainability of the hospital sector has become an important issue to tackle. Within weeks, the pandemic rendered our hospitals' financial plans and budgets irrelevant. Within months, completely new spending priorities and planning needs have arisen. And for the first time in my career, our operating budget bore little resemblance to what unfolded during the year. This challenged us to think differently about how we sustain access to services while addressing resource-intensive needs of patients requiring specialized care. We set out to streamline select action plans aligned with our strategic priorities in order to ensure resilience in financial, operational, and commercial capacities. We secured financial preparedness and sustainability, particularly in working capital and liquidity management. This enabled us to procure the necessary provisions and equipment to help our people transition to the demands of the pandemic, making it safe to respond to the crisis and keep going. And in a situation like this, risk assessment, stress testing, and contingency planning are the most valuable things an institution should do to determine what they can handle and how they can handle it. We focus on operational adaptability. The scale of the COVID-19 pandemic demanded a stronger incident response than typical emergency events we manage, such as dengue or influenza. The extensive duration, combined with high transmission risk and a massive scope of impact, urged us to prepare for complex facility, equipment, and staffing needs. We set up a command center, reorganized teams, defined roles, and clarified who is in charge, not to control, but to put an order and help boost each team's morale. We aim to navigate and bounce back commercially. And as the pandemic delayed non-emergency care for millions of people, our best strategy was to make use of what we had and integrate innovative data-driven tools to scale existing emergency response plans for COVID-19 unprecedented proportions. These transformed into new products and services the hospital offered and brought changes in customer behavior and patient preferences. An example of this is telehealth, which has quickly become the silver lining of the pandemic. During a time of physical distancing, our IT team developed technology platforms, particularly for telemedicine, that gave us unique opportunities to reach individuals. With beds full to capacity with COVID-19 patients, we had to be innovative. And by choosing technology for remote monitoring and developing data and fraud safety nets, we provided patients with tools that benefited them rapidly and efficiently without having them to leave their respective homes. We began to actually look at the data. And data can help drive decision-making as a reference point that success can be measured against. These physical and virtual hubs and dashboard offered us a 24/7 bird's eye view of where every patient is, from admission at the emergency room to an inpatient bed. And they were designed to help reduce patient gridlock, enhance quality and patient safety, and support and improve patient and staff experience. This pandemic sheds a light on the interconnection and interdependence of businesses and their full range of stakeholders. For Cardinal Santos Medical Center, we collaborated with our government and business partners in conducting COVID-19 public education webinars and in providing healthcare workers as volunteers in COVID-19 vaccination programs. Collaborations with stakeholders across industries play an important role in the response to the COVID-19. This is something that we need to improve even further, not just to respond to a pandemic, but for us to handle broader issues together. Just as COVID-19 penetrates our immune system's weaknesses, the pandemic has stressed certain functions of the healthcare industry to a breaking point. And by understanding the impact of economic realities, poor patient outcomes, delayed procedures, and lack of attention to existing problems, we can better comprehend the magnitude of these circumstances. Currently, hospitals and private clinical practices face steep financial challenges. Many people were forced to take quarantine measures and stay home from work, school, and large social activities. Simultaneously, many put off scheduled medical procedures out of fear of contracting the virus. Worse, 24/7 coronavirus news coverage has pushed existing healthcare issues to the back burner. The pandemic could bring more unprecedented challenges. How do we cope not just with the pandemic, but with the economic consequences of the measures put in place to address it? Safe distancing, lockdowns, and such. While most activities have come back, some remain restricted. In reality, it is not a question of trying to hold it at the borders. It is a question of, you've taken the punch. How will you be able to bounce back? Under the circumstances, I could not have asked for more. With our intentionally agile approach to scenario planning, we have been able to adapt, cope, and overcome those challenges. And as the third surge rolled in, we were sitting from a position of strength financially. Sustainability requires evaluating not just finances, but also systems like building infrastructure and organizational practices. It also requires implementing measures in line with effective contingency preparedness and adequate stewardship of funding priorities. Hospital facilities need to have reliable and resilient engineering system to ensure safety for their patients. Our strategic approach to healthcare sustainability incorporates factors such as restricted financial resources, the rigorous accreditation processes, and a low risk tolerance. Strategic planning is never easy, and it has gotten even more difficult with the COVID-19 pandemic. Baseline forecasts of revenues and costs are tough. And who knows whether a new wave or a new vaccine will change everything. Yet, decisions must be made. The greatest value of strategic planning may be in identifying uncertainties and options, even more than laying out a fixed path for the future. As hospitals deal with COVID-19's huge financial impact, we must ensure we make hard but also smart staffing choices. We must both manage the immediate disruption of the workforce brought about by COVID-19 and leave room for sustaining and rebuilding it for the future. Many clinicians will feel the long-term health effects from the pandemic. Some will choose to exit, some may pass away. A new class of rising clinicians will have their education disrupted. These implications for the workforce are definitely potentially traumatic, but we must find opportunity in tragedy. The answer is not to struggle to rebuild the old workforce, but to shape a new workforce better suited to healthcare's future. And this means shifting to staff-efficient care models, maximizing contributions from all clinical and non-clinical staff, and extending reach with digital tools to promote patient self-management. Going forward, we as leaders need to embrace a vision of empowering frontline clinicians and staff. We owe them transparency to help them understand the full scope of considerations influencing each decision. Such an approach allows employees to make choices that are optimal for the organization and has been shown to reduce their anxiety while improving enterprise performance. Meanwhile, we need to restore pre-pandemic revenue with a recovery path for new or revived care models. It is not just a matter of bringing back revenues into the door. We must be certain that our plans will result in financial sustainability for the organization. We must look into how we can build new capabilities to unlock new revenue sources. We must review our supply chain for improved negotiated contracts in terms of reliable delivery lead time and better credit terms, particularly for key supply items. Pandemics are not a matter of if, but when. With this in mind, there are several lessons that can be learned. First, COVID-19 has taught us how essential contingency planning is. Emergency management plans should be easy to implement and frequently updated to fit any situation. Instead of having a plan just to check a regulatory box, hospitals should develop a hospital-wide policy that makes emergency management an integrated part of operational strategy and incident command systems a part of everyday work. Second, COVID-19 has demonstrated the importance of vigilance. Infectious diseases have been relatively common over the past decade, but we should still be ready for any risk of resurgence. We must maintain essential capabilities to respond to an outbreak or event. Vigilance requires ongoing emergency preparedness. Monitoring of risk must remain a constant part of our daily operations to help ensure safety for patients and staff. Risks that could potentially lead to unsafe situations for patients and staff must be communicated efficiently. COVID has been a real-life stress test, an uninvited but necessary stress test on our healthcare system. But every crisis can be turned into an opportunity And COVID-19 has provided us a once-in-a-lifetime opportunity to make bold choices that put us on a path to resilient, inclusive, and sustainable recovery. COVID-19 has put everyone involved in the healthcare sector under very enormous stress, especially the patients and the healthcare workers. It has redefined hospitals' duty of providing quality medical care and created a shift in management strategies and tactics. Strategic planning and financial sustainability in this sector is needed now more than ever. Clinicians need to quickly learn what matters to patients, just as we in hospital administrations need to focus on what matters to people on the front lines, all while working to better understand the patient and communities we serve. In fact, my role as CEO has taken on a new meaning. In a normal environment, it's about business leadership, setting up strategies, as well as culture and people decisions. In this new environment brought about by the pandemic, it's about helping people maintain morale. It's about preparing people for whatever may come in the face of uncertainty. It's showing up differently using a different lens to take notice of how members of my management team show up. These areas are candidates for permanent change in the future. We have been battered by a sustained period of fear, but we also face a great opportunity to forge a stronger, more cohesive, and motivated workforce. We extend hands virtually, truly listening, relating to and connecting with people wherever they are. There is great potential to inspire people and strengthen bonds and loyalties within the organization. The people I lead have big expectations of me, but the more human I am with them, the more trust and empathy they lend, not just to me, but to their patients as well. I let you go with one more lesson to bear in mind. Leadership means being the organization's rock during a time fraught with anxiety and uncertainty. People need to see that their leader is committed, competent, and compassionate, making decisions in accordance with the organization's values, developing new ways to keep going even in the face of hardship, and forging a more sustainable future.